So anyone? So I will move forward. Okay. So the diet is derived from the Latin word dietia or the Greek word dietia, which means prescribed way of life. It is nothing other than the food. It is also related with the way of life, regimen, or dwelling. It is a correct diet. Okay. Prescribed way of life or the lifestyle is called the diet. So in this way, we are moving forward. Ahara, you are knowing what is the meaning of the word ahara. It is that which is ingested in the form of, it is called a diet. Okay. You are knowing the different layers of the skin, and you are knowing the different skin diseases which are affecting and different layers. I think all these points are you are knowing. So we are typically dealing with the Ayurveda about the diet and skin. The concept of Kushta or the Tokroga, it is basically classified Aharja Nidana, Viharja Nidana, Manasika Nidana, Vishesha Nidana, and Sahaja Nidana. Okay. And among these, Aharja Nidana, the food related causes, and the Viharja Nidana, regimen related causes, are mainly explaining here in this class. Okay. So, first of all, the Aharja Nidana. Asking what is in the treatment of skin diseases. Anyone? What is the importance of Ahara Nidana in the treatment of skin diseases? You can give your answers through the chat box. Why Ahara Nidanas are important in the treatment of skin diseases? Am I audible, doctor?
Yes, doctor.
So I'm moving forward. Ahara Nidana, the food-related causes for skin disease. It is mentioned in Ashtanga Charanga Samhita, okay, indigestion. Okay. It is not strictly like that. It is mentioned as in different textbooks, Ashtanga Charanga Samhita, in the context of Kushtradana itself. All these foods should be restricted or avoided in skin disease. That's the main point. Under the context of Nidhana of Kushta or Tokruga. That's the main point that I want to dealt with. Food-related causes of skin disease are mentioned as Nidhana, and they should be avoided according to Ayurveda in all the skin patients. That's the main context that I want to share. So, which are the Ahara Nidhanas which are mentioned as factors? And one mentioned as the causative factor for skin disease, strictly speaking, Aharaja. So I will tell. Okay, this is a book from Central Council of Research in Ayurveda Sciences, the authority of research in Ayurveda. They have published Ayurveda-based diet and lifestyle guidelines for the prevention and management of skin disease. It is based on our classical textbook that they have prepared this. Okay, and in our classical text, it is mentioned as Adi of skin disease. Adi Ahara means excessive intake of salty. So strictly speaking, we don't tell if we are strictly speaking about those presented now. Okay, in this century, that what we are eating, the salt and salt dominant foods such as pickles, papad, bel puri, chips, mixture, namkeen, all these are at the leaven ahar. These are causing skin disease. So these are to be avoided in skin disease. And atambla ahar is also mentioned, excessive intake of sour food. The best examples are fermented products. Okay, curd, excessive amla curd. Okay, buttermilk, pickles, fruits soaked in vinegar and sour substances. Like in Kerala, they are using that. Belpur is also Nadi amla ahara. Vinegar, alcohol, tomato sauce, excessive use of tomato sauce also a causative factor, or it should be avoided in skin disease. Okay, the excessive use of rasam, excessive use of tomato and tamarind should be avoided in the case of a skin diseased patient. Okay, excessive intake of preserved foods. Okay, then sour fruit juices such as musambi juice, lemon juice, orange juice should be avoided for a skin patient. And with hot radish with meat. Okay, all these should be avoided. Guru, hello.
Hello. Hello. There is some problem with the sound. Like maybe some issues with the mic.
മഞ്ഞളിപ്പത്ത് ഏതെന്നറിയോ? കള്ളപ്പരിപ്പ് അയച്ചിന് തേങ്ങയുണ്ട്.
Hello. The faculty will join soon.
Hello. Hello, Agil Doctor.
Yes, doctor.
From where it is problematic? From the first slide itself?
No.
Okay, whether you can tell from the which point that is. Hello.
You can go on, doctor. Go on.
From this slide, Nidana.
Not from this. Maybe you can just move a little more.
PCRAs.
Yes, it's already over.
Okay. From the here
Yeah,
you
from
want to
this
start.
from this weekend.
Okay. So here, whether it is clear now.
Yes, doctor, it's clear.
So from the classic, it is mentioned as Adi Levana Ahara, the excessive intake of salty foods. It is based on the foods which we are using in our era, okay, in this century. Means salt and salt predominant foods such as pickles, puppet, bel puri, chips, mixture, namkin, okay, and also atyamla ahara, fermented products, curd, buttermilk, pickles, fruit soaked in vinegars or substances, bel puri, and tomato sauce, rasam, excessive use of tomato, tamarind, preserved foods. All these are coming under atyamla ahara. Okay. Then also these are fruit juices like Masambi, pomegranate, orange, tomato. All these should be avoided. And in Viridahara, you are knowing that sprouted vegetables, mixture of meat and milk, chicken and curd. Okay. Honey with meat, honey with hot water, radish with meat. All these are coming under Viridahara. These should be avoided for a skin patient. And in Guru Ahara, the intake of hard to digested food like today's food like biryani, mandi, pizza, cheese mixed foods, bakery products, paneer mixed foods, all these should be avoided for a skin patient or should be regulated for a skin patient. Okay. And regular intake of meat products, milkshakes, ghee, food items prepared from black gram, especially masala dosha, uttapam, like that. And for Snigdahara, it is also mentioned as a causative factor for skin disease. So these should be also avoided. Biryani, oily fried meat products, banana fry, cutlet, bhaji, meat soups. Okay. And sweets prepared from excess ghee like Mysore pak, peda, these should be avoided for a skin patient in nowadays. Adi Drava Ahara, excessive intake of juices, soft drinks, madhya, milk. Okay, all these should be avoided. Sneha Adi Sevana, means intake, excessive intake of oils and fats is also mentioned as a causative factor. So these should be avoided, like sabji, curries. Okay, the oil should be limited in sabjis, curries, thoran, also those things. Excessive intake of ghee should be limited. Excessive use of fried and oil mixed food should be avoided. And asatmya ahara, intake of uncongenial foods, the foods which are not suitable to one's own prakriti. Okay, kaba prakriti person taking excessive kaba rich foods, food which are not suitable to that desha, which is grown outside. For example, dragon fruit is not seen in Kerala, but we are consuming it. It is asatmya ahara according to a Keralite person, okay, or a Malayali. Consumption of food which are not native, use of pizza, noodles, pasta, all these are not native in India. Okay, so they should be avoided for a skin patient. Ajirna ahara, intake of food by a person before digested food. In Kerala also there's a custom of taking vada cutlet at 11 a.m. in between the meals. It is also not good. Okay, and it is typically mentioned in the classics like Ajirne Madhu Fanida Malse Lagucha, means habit of intake of honey, jaggery, fish, radish, all these should be avoided. And the best examples are chilijima mixed with paya. All these are mentioning. Then so many people are preparing on this day. And Shidoshna Ahara together. Intake of cold water soon after eating hot food. Intake of cold coffee and tea at a time. Intake of cold water soon after eating chicken curry. Or intake of boiled water after taking shakes. Okay, all these should be avoided. And dahi, okay, should be avoided, strictly avoided in a skin disease patient, especially in the form of lassi, raita, dahi vada, curd rice, vegetarian curry like avial, non-vegetarian fish curry, chicken curry, which dahi is used as a mixture. All these should be avoided in nowadays. Intake of fish should be avoided strictly for a skin patient. Okay. Masha, you are knowing black gram. Okay. It should be avoided. Pishtana means those which are prepared by grinding rice and gram, like vada, dosha, uttapam, dokla. All these are causing some problem to kabaja, and it is also a problem in skin disease. Tila is also mentioned as a apatya for skin disease. So it should be also avoided. Excessive use of jaggery. It is also mentioned in our classics as a apatya for skin disease. So it should be avoided. Radish, it's a regular use of radish. It's a cause for skin disease. Okay. And Adimadhyamana, you are knowing excessive intake of alcohol. Harida shaga, like spinach, broccoli, cabbage, lettuce. Okay. And beet greens, all those should be limited. Okay. Excessive intake of Harida shaga will cause rokshada. It is also a causative factor. Then Vidahi Anna, you are knowing all the foods which are seen in nowadays, like different fried fruits, okay, chicken, varieties of different varieties of chicken, meat products, all these should be limited. And garlic is also mentioned as an apatya in skin disease. And Preklinana means old rice water, curd rice, the fermented and putrefied food products. All these should be limited or avoided for a skin patient. Gramya Anubadaka means you are knowing that meat of domestic animals like buffalo, fish, all these should be avoided. Kurchika, you are knowing paneer. Okay, Khilada cheese products, kadai, like kadai paneer, cheese balls. I am telling the examples from our own market. Okay, or that's why I'm telling like this. Gramya Anubadaka means you are knowing the different forms of food products that are available in our the table, okay, dining table. So it should be avoided. I am placing one photo for this. So these are the different aharja nidanas, and these should be avoided. Or you should tell the patient that you are having skin disease, and these are the causative factors. So you should avoid or limit the use of these products in your daily routine. Okay, that's an important factor you should consider while prescribing diet to a skin patient. And the Viharja Nidana that I am mentioning, that which are you are knowing that Vamana Vegaroda, Panchakarma Bachar, improper practice, or even consumption of cold water after afflicting with all those things. Use of Ananapurva Shidoshna, it's a very important factor. Non-compliance of rules with regard to hot room. You are knowing that certain exposure to hot weather from AC rooms also cause some irritation to the skin. Okay, all these are Viharja Nidanas. So this is the important factor that I think you are we have completed the apatya, or which are to be avoided for a skin diseased patient. Okay, these should be taken in consideration. I'm telling about the Ayurvedic aspect only in the first part, and we will discuss about the modern part in the next coming slides. So, which are to be added for a skin disease patient? The Patyahara. Can you name some of the Patyahara for a skin patient? You can add your answers on your chat box. Whether till this portion it is okay, it is audible and you are getting all the points, I think. I will tell Moong Dal. The answer is coming. So which are the patya? Yes. Best patya is shali, the normal rice. You can take rice, no problem. Old rice is not good, or curd rice is not good, but the normal shali or rice is whatever you can take it is a patya. Eva, it is a patya. Hadiam vulgar, it is a patya in skin disease. Goduma. We North Indians can use Goduma chapati is a patya, so you can use Goduma, no problem. Kodrava, it is a patya, mentioned as a patya in skin disease. It is an apatya for so many diseases, but it is mentioned as a good food, good diet in skin disease. Bakuji are knowing it is a rasayana also for skin, and it is used as a thing. Then amalagi, the best thing which can be used for a skin disease patient, amalagi. Mudga, I think it is mentioned, green gram. It is patya for skin disease. Kagamaji, Solanum nigrum is also patya. Karavelaga, you can use this thing, Karavela. You are knowing that bitter gourd, it can be used as a patya for skin disease. You can use the water of Kadira, Acacia category. Okay. You are using Kadira mixed water. It's very good for skin disease. Nimbapatra, it is a very good patya for skin disease. You can use the water of Nimbapatra also. Jadi Phala, it is a patya. Brahadi, you are knowing this. I am showing the photo. It is also patya Solanum indicum. Punarnava, we can prepare the curry of Punarnava. It is also a patya for skin disease. Even Kunkuma is also a patya for skin disease, but we are not using as such. But in nowadays, we are using it in different forms in gear like products. Teletaila is a patya. Sesame oil is a patya. Okay. Nimbataila, neem oil is a patya. And the other oils are not mentioned on our classics. Okay. And you should eat only in required quantity. That's important point. It is mentioned as a common patya. Jeerne and or eat only when the earlier food is digested. Timely food is a must for any disease rather than skin disease. Timely food is a must for any of the disease. Why? Because most of the patients that we are dealing in our OPD are having untimely food. They are not strictly going taking food at their time. So it's the best time to take food is in the morning. It should be 9 to 10, 8 to 9. 1 hour you can give as a gap. 8 to 9 is the best time to take food in the morning for the breakfast, and for the lunch it is 1 to 2, and for evening it is 4 to 5, and at last in the night it is 7 to 8. Okay, it's an important thing. And you can use meat of animals like goat, sheep, turkey. You can use suitable food, freshly prepared food, avoid spoiled food and newly harvested food. These are different patya, which is mentioned, and these should be given for a skin patient. You can give the green vegetables, not a problem, but not in large quantity. You want to change the different types, spinach, all these can be given. Okay, and Pati Vihara, you are knowing that cut hairs and nails, Abhinga, regular Akki Abhinga, regular bathing, and regular cleaning with Kadira Kashaya, direct exposure to hot, avoid direct exposure to hotness and coldness, cold breeze, okay, and all these can make skin healthy. This is the Ayurvedic part which is dealing with, I think you are knowing most of these portions, but under the question then it is mentioned as such. So my question is typically related with this, whether diet has any role in the manifestation and treatment of skin disease. I'm asking on the aspect of modern aspect, strictly speaking on this aspect of modern. What is your opinion? Yes or no? I think you have completed the Ayurvedic portion, but I'm not strictly speaking whether there is role of diet in the manifestation of skin treatment of skin disease according to modern philosophy. Anyone? Please give answers, yes or no. Whether till this portion it is okay? Okay, I am asking whether diet has a role in the treatment of skin disease. Yes or no? No. Yes, no. So my answer is yes. Okay, I will tell. The dermatological diseases are basically can be classified into 5 types. Okay, dermatological disease in which diet has a definite role. Dermatological disease in which diet has a probable role in etiopathogen. Definite role is there, probable role is there. Dermatological disease in which specific factors in direct diet are directly implicated in the etiopathogenesis. Genetic and metabolic disorders wherein either the elimination of diet is mandatory or a dietary supplementation of specific factors is beneficial. Disorders related to deficiency, like sugar, like that, and miscellaneous disorders with an uncertain relationship. Means all these others have been verified and validated through clinical studies. Okay. So diet has a specific role in the manifestation of dermatological disease, and the treatment wants to be in that way also, that we will explain in the coming slides. Okay, that's my answer. So this is my question. Name the disease in which diet has definite role in its manifestation. According to studies, can anyone tell? Definite role that this diet will cause this problem. Can you give any other examples? I will tell you an example. Celiac disease. Okay, a gluten rich diet will cause. Okay, psoriasis, it's okay, but it is not a definite role. I will tell it in the coming slides. Okay, we will discuss. The first answer is whether in the disease in which diet has a definite role, the answer is dermatitis herpetiformis. Okay, what is the diet? I will tell. Dermatitis herpetiformis, a gluten-free diet is a must in the management. Okay, okay, the gluten-rich foods will cause this problem. And this is my question: whether they name the disease in which diet has probable role. It is not definite, probable. Sometimes it will cause, sometimes it will not. Probable role. Can anyone answer this question? Are you getting the point? These are the diseases. Okay, probable role. Yes, psoriasis is coming under this thing. It is not seriously. Okay. Sometimes it will probably it will cause atopic dermatitis, acne. You are knowing acne, psoriasis, pemphigus, urticaria, pruritus, allergic contact dermatitis. These diseases, these skin diseases, there is diet is having a probable role in the etiopathogens of. Sometimes it will cause, and we will deal with all these diseases in the coming slides. Next, name the disease in which specific factors in diet are directly implicated. Some factors in diet are causing some problem or making that skin disease. Can you name any of them? The third type. These are the thing. Fish odor syndrome, toxic oil syndrome, and fixed drug eruption. Okay. Fish odor syndrome, toxic oil syndrome, and fixed drug eruption. These are the diseases in which specific factors in diet are directly implicated. Next, name the genetic and metabolic disorders in which either an elimination of diet is mandatory or dietary supplementation of specific factors is beneficial. Can you name any of them? You are knowing some of them. Having skin manifestations. You are knowing phenylketonuria. Okay, tyrosinemia, homocystinuria. Skin manifestations are also there in these diseases. They are not typically skin disease, but they are having genetic and metabolic disorders, but skin manifestation is also there. G6PD deficiency, xanthoma, gout, and porphyria. Okay. Name the disorders related to deficiency or excess of specific nutrients. Kwashiorkor, marasmus, phynoderma, pellagra, scurvy, carotinemia, lycopenia, acrodermatitis enteropathica. All these are disorders having deficiency or excess of specific nutrients, and they are having some skin manifestations also. And these are diseases miscellaneous. Okay, they are considered as miscellaneous, in which diet, the relationship of diet is said to be uncertain. It is not at validated. Okay, it's not at found out that it is having some role. Vitiligo, rosacea, aphthous ulcers, cutaneous vasculitis, and telogen effluvium. So we are strictly going on the first. So first question is, name the skin disease in which gluten-free diet is a must in the treatment. If you are treating it seriously with your treatment, Ayurvedic treatment, and if you are not giving gluten-free diet, nothing will happen, which is a disease. Anyone through the chat box? Whether you're getting me? Whether this point is okay till then, till this point. Whether it is new for you, these topics, the last point, all these portions that I am mentioning. Okay. So the answer is dermatitis herpetiformis. Okay. It is not psoriasis. Psoriasis, there is a probable role, but definite role is dermatitis herpetiformis. Okay, and the treatment includes gluten-rich diet is a causative factor. So the treatment includes the best treatment is use gluten-free diet. You want to avoid like celiac disease. Celiac disease also is having the same. So avoid wheat, rye, oats, and barley, all the gluten-containing products. Rice, you can use rice, corn, and potatoes. And also iodine is also restricted for a dermatitis herpetiformis patient. Avoid iodine-containing foods like fish, iodized salts, and vitamins. Okay. So what is a gluten-free diet? Can you name some of the gluten-free diets? What is the difference between food and diet? Anyone? What is the difference between a food and a diet? You can answer to chat box. You are telling that food is there, diet is there, isn't it? Food is in the form of you are having that cereals, pulses, grams, or like that wheat, barley, etc. Diet is in the form of a dish. Basically, you are having chapati or like that. Okay. So these are the gluten-free foods. Superfood having gluten. Best examples are fruits and vegetables. Also, almost all the fruits and vegetables. Okay, and fiber-rich foods like sesame, flax seeds, husk, amaranthus, lupin, buckwheat. All these can be included as a gluten-free diet. Yeah, millet chapati you can use. Millet's the best example of gluten-free diet. Millet chapati. Okay. So foods to avoid wheat, barley, rye, processed foods, gluten-containing condiments, contaminated foods like that. But we can add
ഫുഡൊക്കെ കഴിച്ചോ? കഴിക്കാൻ പോണല്ലോ അല്ലേ? ഇന്ന് ക്ലാസ് ഒക്കെ ഉണ്ടായില്ലേ?
and we can add fruits and vegetables, legumes and nuts, dairy products, meats and fish, eggs, gluten-free frozen and starches. Okay. Iodine should be restricted for dermatitis herpetiformis. You are getting? Now we are starting with probable role. The best example is atopic dermatitis. You should avoid cow milk and egg. Okay, strictly in the treatment of atopic dermatitis. Thus, these foods have created some problem. These foods have been shown to have some probable role in the etiopathosis of atopic dermatitis. So you should strictly restrict the patient to take cow milk and egg. You're getting that point. Next, acne. And acne, this is important point. You should avoid processed food. Non-westernized diet, it is good. What is non-westernized diet? Avoiding processed food, cereal grains, dairy products, refined sugar, refined oil, unprocessed fresh fruits, vegetables, and lean meats can be used. Okay, you should avoid processed foods, all the bakery foods, all the packeted foods, all the outside foods, and you should restrict to fresh fruits, vegetables, lean meats, and the freshly prepared food from your house. It is also an important treatment in the treatment of acne. You should consider this. Okay, why? You are having caffeine. It will also cause some problems. Caffeine will increase hormone production. So like coffee, tea, cola, chocolate is not good in even in acne patients. And most of the acne patients are of adolescents, and you should tell them to avoid these chocolates like in their food. And refined carbohydrates and sugar should be restricted. That's an important. Take the food from outside in the form of bakery foods. Dairy and meat products should cause individual sensitivity to some patients, and you should avoid also those things. Tuna is strictly restricted due to high mercury level in that. Okay. And almonds, peanuts, walnuts should be restricted. Clear? Acne, I think you are having cases of acne rather than and also atopic dermatitis rather than having dermatitis herpetiformis. So this should be considered while prescribing from today tomorrow. Now, whether you are prescribing diet like this in this day or you are strictly following the Ayurvedic principle, you can answer in the chat box. Whether you are prescribing diet based on this that I am telling, or you are daily prescribing on the basis of the Ayurvedic intervention. Am I audible now? Whether it is clear?
Yes, doctor.
Okay. So this is the question. Name the skin disease which has link with obesity and cardiac mortality and has higher risk of myocardial infarction. Anyone? I think we have discussed this in our quiz. So what is the answer? Acanthosis nigricans. Okay. Cardiac mortality is there. Yes, it is obesity related, but cardiac mortality, okay. There is another skin disease which is common. Okay, the answer is psoriasis. Okay. There is a link between psoriasis, obesity, and cardiac mortality, and those patients who are having obese and is having psoriasis, there is high risk of myocardial infarction. Myocardial function problem is there, and you want to check the ECG or you want to do the TMT of all the psoriatic patients that you are dealing with. You want to ask whether they are having some problem with breathlessness, whether they are having palpitation, whether they are having problem with their walking. Okay, all these should be considered from tomorrow. If you are not considering till now, you want to consider this point. It is very, very important that you should consider. In all the cases, it is not like that. But it is, yes, studies are there. That's why I'm telling how it is linked with studies are there. It is an autoimmune disease. You are knowing it is a immune-related response. So it is also causing some problem. And most of the patients are having, in all the cases, not like that, but most of the cases, if the patient is obese, having psoriasis, there is problem with cardiac functioning also. So you should check that whether the patient is okay with cardiac function. If it is not there, it should be taken into consideration. Okay, but because I am having two patients in which this happened like this, the cardiac arrest was there, and you should consider this point. Clear?
Doctor,
So
there's
regarding
a question regarding this, how it is linked with cardiac.
That's why I'm telling. That's why I'm telling. It is studies are there that most of the there are studies are linked with. I will tell that. I will share that PPT with you. That point with you. The link is that so many studies are there regarding that obese for psoriatic patients. They are checking the cardiac functioning, and most of the patients are having this, and some of them are having risk of myocardial function. That's the thing. This link is related with, I am telling this link is that it is based on the studies that I am telling this.
Okay, doctor.
And you should follow, this is the best diet. The vegetarian diet is best for psoriasis, especially avoidance of alcohol. Why? Because histamine release is there. It's an important factor rather than alcoholism problem. That's not the main problem. The main problem is releasing mentioned with histamine release. But in modern, omega-3 fatty acid should be added. It is mentioned like that. In Ayurveda, it is strictly prohibited, but in modern, it is telling like that. And we can stick on to Ayurvedic also, Ayurveda only. This is the point. Okay, energy intake and psoriasis. Fasting periods, it is good. Why? Because decrease arachidonic acid intake. Low calorie diet, decrease CD4 cell activation. Vegetarian diet, increased anti-inflammatory cytokines. IL-4. Okay, less oxidative stress, and it all will cause improvement in psoriasis. So low calorie vegetarian diet with fasting can can improve the stage of psoriasis. You are knowing that psoriasis can be controlled. Okay. And even omega-3 fatty acids and omega-6. The best is, which one is best? 6 or 3? You are knowing that examples is there. Omega-6, it is linoleic acid in the form present in sunflower seeds, arachidonic acid present in meat and egg yolk. Okay. What will happen? Inflammatory response is that tissue responsiveness to cytokines will be there. But in omega-3, it is good linolenic acid seen in linseed walnut oil and fish, mackerel, herring, sardine, salmon, all these having these type of omega-3 fatty acid, which is good in psoriasis. Studies are there. Okay, these should be considered. You should strictly follow a vegetarian diet, low fat diet, and avoidance of alcohol, and strictly adherent to omega-3 fatty acid rather than going for other fatty acid rich foods. And Femigus. In Femigus, the important point is you should avoid food items containing thiols, thiocyanates, phenols, and tannins. Okay, all these are causing problems. You are knowing that thiols seen in garlic as garlic, or thiocyanates seen in mustard oils, or phenols. Okay, these are the products that should be controlled or limited, or you should avoid for a Femicus patient. Garlic, onion, mustard, radish, cabbage, cauliflower, potato, tomato, ginger, even mango, raspberry, pistachio, avocado, cherry, banana, everything, all these are having tannins. Okay, that's why coffee, tea, cassava, beer, wine, soft drinks, ice cream, candy, baked foods, and all the food additives such as benzoates, tetrazine, coloring agents, all these are having problems with Femicus, so it should be avoided. Okay, so you are knowing which are the foods which are containing high amounts of tannins. Can you name some of the foods which are having high amount of tannins among these? Why? Because we are studying Swasthavrta, we are studying Ahara as a part of our Swasthavrta, but we are not dealing with, we are only studying with Ahara Vidhi, we are dealing with Ahara Krama, we are dealing with 12 type of Ahara, we are dealing with all this Ahara. But we are not mentioning about the properties of the food that we are taking and the property of the food which is around us. We are not assessing the Rasaguna Virya Vibhaga of biryani. We are not assessing the Rasaguna Virya Vibhaga of mandi. We are even chapati it is not knowing, isn't it? We want to assess the Rasaguna Virya Vibhaga of all those foods. Okay. Tannins are seen in mango, raspberry, apple, pear, avocado, banana, blackberry, cashew nut, walnut, peanut, okay, coffee, tea, cocoa, beer, wine, soft drinks. Even in ginger, garlic, red chilies, asafoetida, and coriander, cumin, black pepper, ajwain, all these are having tannins. So you should limit this when considering a Femicus patient. Urticaria, you are knowing urticaria. The modern aspect, we are mentioned about all these things in the last case discussion. So there are some disease, there are some food items which are causing allergy. Sometimes in some patients, haldi is causing problem. Even turmeric will cause, Rajanya Churna will cause urticaria. Okay, the best treatment for urticaria is Haridradikanda and Rajanya Churna. But even in some patients who are sensitive to turmeric, okay, especially curcumin, will have problems with urticaria. So you want to identify which are the food items which are causing allergy. Especially salicylate, tetrazine, benzoates, aspirin, all these are causing allergic reactions. So for considering an urticaria patient, you should consider the food sensitivity test you should do. And which are the sensitive foods for that patient, you should avoid those things. Okay, you should consider from in the OPD these points. Pruritus, you are knowing uremic pruritus. Restriction of dietary protein is a must in those cases. And there is also cholestatic pruritus related with gallbladder. There supplementation of polyunsaturated fatty acid should be given. Allergic contact dermatitis. You are knowing contact dermatitis. I think we have mentioned in the previous cases. Okay, so there is latex fruit syndrome is there. Sometimes some fruits are causing problem, contact dermatitis. Especially it is called latex fruit syndrome. Avocado, touch with avocado even cause this thing. Banana, potato, kiwi, peach, tomato, bell pepper, turnip. All these are having this latex fruit syndrome. Okay, some patients are, especially Pitta Prakriti patients, are having these allergic reactions. And some patients are having allergic towards nickel, canned food, due to the presence of nickel in that. And also some are having candy, chocolate, cinnamon, citrus fruits, wine, flavorings, all these are there. So you want to identify which is the problem, which is the thing which is causing that problem. Contact dermatitis is caused by which of these allergens, and you should avoid that. And this is the type which is mentioning that I'm telling that choline-rich foods. Fish odor syndrome is nothing other than trimethylaminoria. Trimethylamine is more in that patients. Usually, choline-rich food is causing this. I'm telling the diet which is causing some diseases. Okay. So it is the example is choline-rich food is causing this trimethylaminoria, fish odor syndrome. Okay. And on this, you should avoid choline-rich foods. Okay, together with the Ayurvedic aspect, you should add these more points. Marine fish is an example of choline-rich. Sea and saltwater, eggs, liver, kidney, peas, beans, soya products, and legumes. All these are choline-rich foods. Okay, and phenylketonuria and tyrosinemia. There, the restriction is phenylalanine and tyrosine should be restricted. So, which are the foods which are containing high amount of phenylalanine? You are knowing this? I will tell. So high phenylalanine is seen in chicken, pork, fish, all the meat products, especially beans. Okay, nuts, seeds, pasta, whole grains, sweet potatoes. All these are high amounts of phenylalanine. So all these food should be restricted if a patient is associated with phenylketonuria, skin disease associated with phenylketonuria. We are getting these cases. That's why I'm telling on these points. Okay, so they should consider these points also. This PPT I will share with you so you can have this. Which are the foods which are containing tyrosine, high amount of tyrosine? These are soy products, chicken, turkey, fish, peanuts, almonds, avocado, even bananas, okay, milk, cheese, curd, lima beans. You are knowing that red color, lima beans, pumpkin seeds, even sesame seeds is also a problem for a tyrosine patient, tyrosinemia patient. So you should consider all these things while prescribing medicine. Homocystinuria means low methionine diet should be prescribed. Avoid milk and its products, meat and fish, wheat and maize, pulses and legumes, nuts and dry fruits, all for those patients. And you can use arrowroot. You are knowing arrowroot or corn flour. Why? Because wheat cannot be used. For North Indian, it is basically wheat. So in these cases, you can add corn flour, arrowroot, custard, sugars, fat tea, and coffee for homocystinuria. And galactosemia, some patients are having lactose problem, intolerance. And they are having skin eruptions. Okay. For those, you should avoid galactose and lactose. You should use lactose-free milk. And calcium and vitamin supplementation should be given for that. And there is G6PD deficiency. So in this case, you should avoid fava beans, chickpeas, and green beans. Okay, all these are having problem with G6PD deficiency, so you should avoid that. And xanthomas, you are knowing that the lipid globules present inside the skin. They are called xanthomas. For that, lipid lowering diet. Avoid fat, egg, meat, and dairy products. It is a must in those cases. And gout. In gout also, you are having that some skin eruptions, isn't it? Pruritus will be there in gout. If uric acid is more than 8 or more, you will have pruritus all over your body due to the increased amount of uric acid in your blood. So for this, you should avoid purine content, especially liver, kidney, yeast, pulses. It's an important factor that spinach is important as a food in most of the diseases, but you should avoid spinach or palak in your food for a gouty patient. Okay, asparagus, fermented meat products, seafoods, and alcohol. Porphyria, it is also a important disease. Carotene containing food should be avoided. It is a problem due to porphyrin. So, carotene contained foods such as carrots and green leafy vegetables should be avoided for a patient having skin problems associated with porphyria. Okay, and in rosacea, avoidance of tea, coffee, hot beverages, tobacco, all these should be avoided. It is mentioned as normal papatya for skin, no problem. Vitiligo. Okay, there is no definite role is there, which has been elucidated, but citrus fruits, sour curd, sour pickles, milk and fish should be strictly avoided for a vitiligo patient. Amla rasa will cause some problem in vitiligo patients. So you are clear with this portion, the modern portion? So along with the Ayurvedic aspect of skin disease, so you are prescribing diet based on these aspects before the class, whether you are prescribing the diet basically on the Ayurvedic aspect or adding all these points, whether you are knowing these points. So you should consider these points also. Okay. And you want to explore more about skin disease. If you are directly dealing with skin disease, you want to explore more dealing with this diet also. You want to consider the health benefit of each and every vegetable, every fruit, every food which you are using in your kitchen. That's an important factor that should be validated. So role of nutrients in dermatological diseases. Can we move forward? Whether it is okay for you? So what is the role of nutrients? You are knowing vitamin A, C, B12, B3, you are knowing the deficiency. Pellagra, hyperpigmentation, B12, you are having hyperpigmentation, vitiligo. Okay, vitamin A is there, hyperkeratinization. Okay, phynodermia, wound healing, acne, all these are related with vitamin A. Okay, vitamin E, anti-inflammatory, erythema, edema, all these will photo damage. Okay, all these are mainly related with our skin. Okay, so you want to consider all these factors. Okay, I will share the PPT. This rather explaining it is easy. So you should have add dairy products. Ghee, if it is a normal skin case, no problem. For healthy skin, dairy products, ghee, legumes, green beans, avocados, omega-3 fatty acids is rich in avocados, flax seeds, olive oil, walnuts, vitamin C rich foods, guava, strawberry, kiwis, orange, vitamin A rich, sweet potato, carrot, liver, vitamin B. It is for a healthy skin. Okay. Beans, oatmeal, chicken, turkey. These are mentioned as healthy skin. Okay. Vitamin E, almonds, olive oil, beans, all these can be. And this is a very important factor, skin, zinc, especially in beans, oysters, and fortified cereals like oatmeals. It is very important. Iron, it is very important for skin. All leafy green vegetables and flax seeds, especially for the hair also. Okay. So role of diet. You are knowing that, I will tell. Which are the natural foods and juices which can give given for a healthy skin? We are dealing with skin disease also, but we are sometimes some patients are coming that whether I can use this, whether I can use this, like that. Okay, so you can give coconut water, potassium content is good. Coconut water you can give, cold pressed coconut oil, virgin coconut oil you can use. Freshly squeezed cucumber juice can be internally taken. Kiwi smoothie, it is a very good thing. Freshly brewed coriander or tea or infusion. Cinnamon tea or cinnamon freshly brewed water, raw strawberries or carrots, veggie, all these fruits and juices can be given for a healthy skin. You are knowing the difference. You are now young. Sometimes after chronological aging begins at the mid 20, and it will be going wrinkles, age spots, dryness, everything is coming. At last, sagging skin is there. Shirede anena idi shariram. What meaning it's that? Shirede, it is deteriorating, but we will see when we are aged only, isn't it? And these are the causative factors. Sun exposure is a very important factor. Photo aging. Okay, sun exposure is very important factor nowadays. Smoking, unhealthy diet, harmful chemicals, allergens, climate, clothing, indoor heating. Okay, indoor heating is there, and even radiation is there. From our even smartwatches are having some radiation. It is called terrestrial, the normal radiation. Okay. How can we control damage to the skin? External and internal care. And which is the best ahara for the skin? Anyone? Which is the best ahara for the skin? We are mentioning so many different types of aharas in the form of liquids and for fluids. So I will tell the best ahara is water itself. Okay, water. Soups. No, it's water itself. Why? Because skin contains 70% water. 2 to 3 liters per water. Okay, and in the form of other fluids also you can check. If your water consumption is low, you can check your skin. Okay, if please take off your skin, pinch your skin, you can realize whether it is good or bad. Please pinch your skin. It will be looking old or new. And vitamin C rich foods, vitamin E rich foods, and vitamin A rich food. It is very important to reduce the effect of sun damage. You're having tar, like all those problems are there. So it is very much important to use these type of food in your normal diet for a healthy skin. I am not dealing with skin disorders, basically for healthy skin. And two main important macronutrients are protein for cell generation and repair of the skin, and fats and oils. Okay, for maintaining the texture of the skin. You are knowing that Kushna is the word meaning Kushnadi Tadvabu. Kushna means it is making the texture problematic. Okay, the texture is going. That's the problem. And the most important two minerals are zinc, iron, and selenium. Zinc is very good for wound healing. Okay, dry skin, itching, rash, diaper rash, prevention of acne. It is very important in the treatment of dermatitis. Zinc is very much important. Okay, so you should take it through the oysters you can take, or in vegetables it is there, oatmeals it is there. Cauliflower, cucumber, tomato, peas, lettuce, banana, blackberry, almond, cashew, palm nut, all these are having this. And selenium is also a potent antioxidant. It is also very much important for a healthy skin. And also iron. and exercises which reduce skin. You are knowing that fat reducing exercises can be used, and these should be taken. Hydrate yourself throughout the day. Swap your carbohydrate. Reduce the carbohydrate content in your food in the form of bakery, packed, canned foods. Trade in your fats. Okay. Criticize your diet. Keep strings and peels. Okay. You can use orange peel. So many peels are there. And look after the protein intake. It is good for your body. If it is in high content, it will cause tyrosinemia, filet, all those problems will be there. If it is in normal, limited quantity and using in normal protein, natural protein, it will be good for our skin. So these are the important points that should be considered. And this is the important point regarding the healthy skin and the different dietary patterns in different skin disorders. And I am thankful for all of you for this patient listening. I think I have covered the portion, almost all the portion. If you want any problem or any doubt, please ask. I think it is okay for you. We have dealt with some of the points. It is okay. Whether you are getting all the points, I think. Collagen supplements, I think I am not in favor of any artificial supplements on the form you can give through meat or meat products. It is good rather than in the form of supplements through artificial means. Natural means is good. Whether the class is okay for you, whether you are getting all the points. If you have any doubts, you can ask. And you should consider all these points while prescribing diet for a patient. And according to Ayurveda, there is 4 aspects. You are knowing Ahara, Ajara, Vihara, and Aushadha. Okay. Very much important in this case. In lichen planus, there is no definite role in lichen planus, but it is mainly related with the external factors. Pathya is there. Vihara is having problem. That's all. Diet is having no direct link with that. But you should strictly avoid Kabaja diet for a lichen planus patient. You should consider Kabaja free diet.
Hello, sir.
Yes.
I think we can't see the presentation now.
Yes, you can tell, In lichen planus, we can add, one question is there regarding the lichen planus. We can add turmeric is good option, neem is a good option, kumari is a good option, tribala is a good option. All these are having very good option. Okay, you should eat cooling foods. That's important. But avoid curd, kabaja related. Zyada kabaja related avoid karna hai. You want to avoid all those things, spicy or salty foods. It should be. And drink plenty of water. These should be considered for a lichen planus patient. And avoid direct exposure to cold and all those mud like those portions should be avoided. It is mentioning in our classics like Tila. I am telling on the basis of the classical textbooks. Okay. Basically, sesame seed, I am mentioning that sesame seed is not advised in some skin diseases. Okay, Tilataila we can use. Tilataila is the most skin friendly. That's why all the thailas are made with tila. Rather than coconut oil, we are using Kera for the head mostly. and Tila is used all over India as a skin, what do you tell, for Abhyanga. It is a skin-friendly medicine. I am telling the use of Tila sesame seeds internally as a patya, especially. Venga, it is more common in postmenopause. It is a factor. It means you are knowing that pathology itself, most of them is associated with PCOD, and it is a symptom of PCOD that is from seeing as a case of Venga. Okay, most of the postmenopausal we are having, and in females, sometimes it is related with high cholesterol content is also there. You can check whenever there is blackish red discoloration, you want to check the cholesterol level of the patient. Sometimes it is related with dyslipidemia status of the patient also. You want to consider this thing and that thing for a postmenopausal woman. And if it is a patient is having fat obese structure, having fat obese nature, you should also check the status of whether she is having some problem with PCOD, not for a postmenopausal normal woman itself. Freshwater and seawater fish. If you are getting freshwater fish within 1 day or on the same day of catching, it is very good as a patya, according to my opinion. But Balsia is mentioned as an apatya for skin disease by Acharya. So I am strictly not adhering fish to a skin patient. I am telling the patient not to take fish in any form. Okay, for a skin patient. Whether it is seawater fish or a freshwater fish. And we are living in Chandigarh now. Chandigarh is not having any direct access to getting fish, and they are telling that they are catching from Delhi. How much time it will be reaching here from Delhi to here? From Yamuna they are catching. Then most probably during seawater fish also we are not getting on the right day of catching. It will be there after 3 or 4 days. So it is rather not avoiding this fish. Coconut oil we can use, it's not a problem. Studies are not there in supporting that it is causing problem. It is also skin friendly and it is a satmia for South Indian people mostly. That's why we are using it more. Okay. And you can see in North India during December or in cold season, it will be cloggy in nature. We can't use. And the best medicine I will tell for a patient having Vibhadika, mostly during the dry season, there will be cracking of this, not Vibhadika, there will be cracking of foods of patients. We will get those cases. And after the treatment with that Jivandyadi Amaga or Sotamadi Leba or any other medicine, it will be cleared. And after clearing, you should advise that patient to take Tilataila or coconut oil as Abhyanga over that region to avoid the occurrence of the disease in other seasons also. For Venga, the best diet, you are asking about diet. Best medicine is Nalpamradikaram. You can apply over the skin. It is very good. And for the skin, I think for a Krisha patient, Venga due to Vata Proko, we can take ghee. Ghee is the best option. And if it is fortified with some drugs, neem or like that, we can take. I'm not taking giving Tikta Grida like that. I am giving neem fortified Grida internally to a normal deshi ghee fortified with neem leaves. Okay, it is best medicine that I am giving. It is having good results. For a diabetic bulle patient, I think the best is diabetic friendly diet itself. Okay. You should, you are knowing that all these causing diabetes, swadamla, or these, you are knowing that nidana for those things. You should avoid all the kabaja reducing, you should avoid all the kabaja causing problems, causing diet, especially, and you should add bitter or astringent taste, rather. You can use neem, turmeric, okay, all those things, and avoid all the sugary and salty food. That's an important thing. You can use amalagi. The best medicine, I think, for diabetes bulle is that you can use Punanavadi Kashayam. You can use that. With Chandraprabha is a good option. Maha Manjishtadi Kashaya can also be used. Thick skin peels of fruit and it's painful. What to be done? So, what is the assessment of the dosha? I am treating on the basis of the assessment of dosha. I will tell which is the dosha and what is the prakriti of the patient, and I am doing on the basis of that what is the treatment that should be done. Okay, that's why I'm asking what are the symptoms and what is the case. The oozing is there. If it is oozing, that we will not apply anything in externally. That's an important principle that we should follow. I think in the previous class I'm mentioning about that. You can apply Jeevandhyadi Amada or Daswatamadi Leba or burn cure ointment. So many options are there. And internally, if it is a severe lesion, rather it is a small lesion, it will be, this is enough. If it is a rather big lesion, you can go for internal medicines. Yeah, Mahamanjishtadi, I think it is Dadugada. It is more over Dadugada rather than Manjishtadi. It is more over Dadugada. Gugulu Diktaga and Mahamanjishtadi, all those Kashayas are having a large number of drugs and we are using on severe condition. I'm using all those in severe conditions only. If it is severe, oozing is there, so many integration of skin into the skin. Rather than the skin, the internal affection is there. We are using Mahamanjishtadi. Whether this class is okay, whether you are getting all the points. I think there are so many type of skin diseases there, but basically these are the considered while prescribing diet for a skin patient. That's why I'm telling. Whether you are prescribing like this in your previous cases or you are starting now itself. I will give that link and whichever it is, it is based on all those studies that is going on. Okay. I'm telling on the basis of studies it is going on. So whether any doubts are there?
Hello, sir.
Yes.
Sir, still I didn't get that Mahamanjishtadi role, sir. It's more Ushna. Hello, sir.
It is having Dadugada action. That's why I'm telling. It is mainly used in internal means Rekta Pitta conditions rather than Vada Kabaja conditions. Rekta Pitta Kaba condition you can use it. It is a main role. I am not using Mahamanjishtadi in simple cases. Rather, I will stop with Manjishtadi itself. Manjishtadi is giving good
Sir,
results.
any skin disease can you mention which you have treated with Mahamanjishtadi?
Psoriasis you can give. In severe psoriasis, erythrodermic psoriasis, you can give Mahamanjishtadi.
Where is Pitta dominance is there?
Pitta Khaba dominance is there. Oozing is more in that condition. You can use that. Oozing will be there and severe itching is there. Pruritus is there. The Adugada affection will be there. More in that condition. You can't treat with Guluchadi, any other normal Kashayas. You want to go with Mahamanjishtadi.
Sir, Shita Pitta we can use because severe Kandu
Yeah.
will be there.
Yeah, Shida Pitta. Shida Pitta, it is simply we can manage with Haridra Kanda or Rajanyadi.
Sir, I
Okay,
have tried,
Kandus.
but I didn't get result on
Yeah, you
diabetic
can
patient.
also add Mahamajistad in that case. If it is not subsiding with the normal, there are a round of Kashaya. I will tell the first round it is coming with Guluchadi. Okay, Panchatiktaga, Manjishtadi. This is the first round of Kashaya. The second round, it is little bit Panchatikta. Second round, it is little bit tragic like Punarnavadi. Okay, Drakshadi. You can even use Drakshadi, Vadapitta condition. And the third one, it is little bit Gugulu Tiktaga, Mahamanjishtadi. All these are coming under the third round. Kashaya. Okay.
Thank you.
Some
Thank
Kerala preparations also there. I will mention in the sometimes in the chat box. I will in the WhatsApp. I will mention those names. Okay. Nimbarajanyadi Churnam is there. It is also very much effective in Shidabita. And you want to identify what is the cause for that condition. Whether the pruritus is due to increased, sometimes liver problem is there, the pruritus will be there. Kidney problem is there, pruritus will be there. Okay, so we want to also check for LFT and KFT in all those cases. It is also associated with those conditions also. Rather than this patient will be telling like that, but we want to identify that. What is the original causative factor? Dosha is the main factor that we should be considered while prescribing patient treatment to a patient.
Yes, sir. Sir, that patient was diabetic with fatty liver, and I have and her IG level is increased. Okay, so I gave her all Mahamanjishtadi also, Viraj, and her Koshta was very Krura. So I gave all Rinimbarajanyadi also, Haridra Khanda also. Now she's better, but still that relapse will come. So I told her to go for Shadana, but she was not ready for that.
You want to consider the Ritu also, the external climate and environment also
Yes, sir.
nowadays.
Sir, I
That's
wanted
why
to
I'm
tell, sir, it was very nice session, and I have attended Ashwathi Madam's session also last 2 months back on VAPS CME. It was very nice session. Both of you have given so much of knowledge. Thank you so much, sir.
okay. Thank you. Tell one more thing that I'm mentioning now. What is the basic difference between Grishma Ritu and Sharad Ritu? Everyone is telling that skin disease are more during Sharad Ritu. Have you noticed that whether skin disease are more during Sharad Ritu? Skin disease are more during Grishma Ritu, isn't it? And in Shida Ritu, like Hemanda Shishira. Skin eruptions are more during those seasons. Why? Because Bala is less in Grishma Ritu. That's the main point that you should consider. And Sharad Ritu is also okay. It is having Pitta Prakopa, but the problem is that Tok is having a relation with Pitta itself. And by normally taking, if we are doing Rutu Shodhana correctly, it is not a problem. You are knowing the difference between Roga Vijnana and Vikriti Vijnana. Whether you are knowing, you are having a subject in your second year that Roga Vijnana and Vikriti Vijnana. So what is the difference between Roga and Vikriti? Simply telling Roga is the stage of Vyakta Avastha, according to Shatkriya Gala. Sanjay Prakopa Prasarasthana Samsraya. All these are Vikrita Dosha Avastha. No Roga is there, but pathogenesis has started, but Roga is not manifested. It is called a Vikriti. Okay. And here also, Pitta Prakopa is a Vikriti only, not a Roga. And the season, the basic difference between Grishma Ritu and Sharad Ritu is that Sharad is Snigdha Ushna and Grishma is Ruksha Ushna. The quality of the Ritu. It is very much important. Rukshada, along with all these causing Abala, is causing the skin disease more in Grishma Ritu. Clear. You want to identify those factors. I think one question was there. I'm not mentioning this in this class. Thank you. Thank you for the patient listening. So we can conclude. Agil doctor.
Yes, doctor.
So thank you
Uh,
for giving me this opportunity once again. Okay.
Thank you, doctor. It was a very highly informative and thought-provoking session, especially mentioning current food habits and its dosage predominance. That was really useful for everyone. In blending Ayurvedic and modern knowledge together, we hope all the participants were highly highly benefited, and we will be looking forward to the next sessions. And once again, thanking you. Good night, all. If you have any doubts regarding this session, you can just WhatsApp in the WhatsApp group. You can just text in your WhatsApp group. Good night, all.